Welcome to StudyNurseIQ. I'm Jenny, and today we're diving into a fascinating and crucial topic for nursing students: antipsychotic medications. These powerful drugs are essential tools in mental health treatment, and understanding them is vital for providing excellent patient care. Get ready for an in depth exploration that will boost your confidence in managing these medications. In the next few minutes, we'll explore the intricate world of antipsychotics, from their mechanisms of action to crucial patient monitoring guidelines. You'll learn practical skills that will directly impact your nursing practice and help you provide outstanding care to patients with mental health conditions. Let's start with understanding psychosis and the brain chemistry involved. Psychosis occurs when there's a disconnect from reality, often due to excess dopamine activity. Think of dopamine like a volume control. When it's too high, it can create static in the brain's communication system. Antipsychotics work by fine-tuning these dopamine pathways, particularly in four main neural circuits: mesolimbic, mesocortical, nigrostriatal, and tuberoinfundibular. Here's a crucial NCLEX distinction. Think of positive symptoms as plus symptoms. They add unusual experiences to normal behavior. These include hallucinations, seeing or hearing things that aren't there, delusions, fixed false beliefs, and disorganized speech. Negative symptoms are minus symptoms. They take away normal behaviors. Picture a person withdrawing from social activities, showing flat affect, or losing motivation. This distinction is vital for understanding both the illness and treatment goals. First-generation antipsychotics, also called typical antipsychotics, are like precise locks on dopamine D2 receptors. Medications like haloperidol and chlorpromazine work by blocking these receptors with high affinity. Imagine them as strong hands gripping tightly to the receptor. This strong grip is what makes them effective, but also contributes to their side effect profile. Speaking of side effects, let's break them down by body systems. The CNS effects include sedation and extrapyramidal symptoms, EPS. Metabolic effects involve weight gain and potential diabetes risk. Cardiovascular effects can include orthostatic hypotension and QT prolongation. Remember, these aren't just side effects to memorize, they're crucial assessment points that will guide your nursing interventions. For monitoring, think of the acronym WEIGH-IN: weight weekly, extrapyramidal symptoms daily, insulin resistance markers monthly, glucose levels regularly, heart rhythm monitoring, involuntary movements, AIM scale, and neurological status. The AIM scale is particularly important. It helps detect and track movement disorders like tardive dyskinesia. Document these assessments meticulously. They're your early warning system for serious complications. Now, let's explore second-generation antipsychotics, also known as atypical antipsychotics. These medications, like risperidone and olanzapine, have a unique hit-and-run relationship with D2 receptors. They bind briefly and then release, which helps reduce movement-related side effects. They also affect serotonin receptors, which can improve negative symptoms but may increase metabolic risks. Here's another NCLEX pearl. Think of it this way. First-generation drugs are like strict traffic cops, high EPS risk, while second-generation drugs are like metabolic managers, higher risk of weight gain and diabetes. The catchy phrase to remember is, first moves muscles, second shifts sugar. This distinction will help you prioritize your monitoring focus for different medications. Now let's focus on critical warnings. Neuroleptic malignant syndrome, NMS, is the most serious adverse effect. Think of the four H's: hyperthermia, hyperrigidity, hyperreflexia, and heavy sweating. If you spot these signs, think NMS and act fast. It's a medical emergency requiring immediate intervention. Before we move to practice questions, let's cement our understanding with the antipsych mnemonic: assessment, regular monitoring, neuroleptics, medication types, treatment goals, symptom management, interventions, side effect management, patient education, compliance strategies, side effects, recognition and management, your monitoring, documentation, careful documentation, legal requirements, history matters, past response to medications. Time for our first NCLEX-style question. A client receiving haloperidol 5 mg twice daily reports muscle stiffness, tremors, and difficulty sitting still. Which nursing action should be implemented first? A. Administer as-needed benztropine. B. Notify the healthcare provider. C. Perform an Ames assessment. Document the symptoms. The correct answer is C. Perform an Ames assessment. Rationale. Before intervening, the nurse must first assess and document the extent of extrapyramidal symptoms using the standardized Ames scale. This provides objective data for the healthcare team to determine appropriate interventions. Question 2. A client is prescribed clozapine for treatment-resistant schizophrenia. The nurse should prioritize which monitoring parameter? Monthly liver function tests. B. Weekly complete blood count. C. Daily blood pressure readings. D. Quarterly lipid panel. The correct answer is B. Weekly complete blood count. Rationale. Clozapine requires mandatory weekly CBC monitoring due to the risk of a granulocytosis, a potentially life-threatening decrease in white blood cells. Final question. A client with schizophrenia has gained 20 pounds in 8 weeks since starting antipsychotic therapy. Which medication is most likely prescribed? A. Olanzapine, aripiprazole, risperidone. The correct answer is B. Olanzapine. Rationale. Olanzapine is associated with the highest risk of weight gain among second-generation antipsychotics, requiring careful metabolic monitoring. Excellent work today. You've mastered crucial concepts about antipsychotic medications. Remember your key takeaways. Regular monitoring is essential. Each generation has distinct side effect profiles, and patient education is crucial for success. Keep these pearls in mind as you care for patients on antipsychotic medications. I'm so proud of your progress. Until next time, keep studying, stay curious, and remember, you're on your way to becoming an exceptional nurse.